What is osteopenia? Understanding your bone density. Osteopenia is a condition where your bones have lower than normal mineral density. This means your bones are weaker than average but not weak enough to be classified as osteoporosis. It is a stage of bone loss that indicates your bone density is below the normal range but does not meet the criteria for osteoporosis. Bone density is measured using a test called dual energy X-ray absorptiometry, often referred to as DEXA. This painless test checks the density of bones in important areas like the spine, hip, and wrist. The results are given as a T-score, which compares your bone density to that of a healthy 30-year-old of the same sex and race. According to the World Health Organization, a T-score between -1.0 and -2.5 indicates osteopenia. A T-score of -2.5 or lower indicates osteoporosis. One of the key things about osteopenia is that it often does not show any symptoms. Many people only find out they have it through bone density testing, often after a fracture or during a routine screening for osteoporosis risk. This is important because osteopenia reflects a weakening of bone structure due to the loss of calcium and other minerals, making bones more prone to fractures. While osteopenia is not as serious as osteoporosis, it can be a warning sign. If bone loss continues, it may lead to osteoporosis. Therefore, those diagnosed with osteopenia have a higher risk of developing osteoporosis and experiencing related fractures. To better assess fracture risk in people with osteopenia, healthcare providers often use the FRAX tool. This tool estimates the likelihood of fractures over the next 10 years by combining bone density results with other factors like age, sex, family history, smoking, and steroid use. This assessment helps determine if more aggressive treatments, including medication, are necessary. Screening for bone density is recommended for specific groups. Women aged 65 or older should be screened. Women aged 50 to 64 with risk factors for fractures, men aged 50 to 69 with risk factors, and anyone over 50 who has had a fracture from a minor injury should also consider testing. Managing osteopenia focuses on lifestyle changes to maintain or improve bone density and reduce fracture risk. This includes getting enough calcium and vitamin D, engaging in regular weight-bearing and muscle-strengthening exercises, avoiding smoking, limiting alcohol, and implementing fall prevention strategies. In some cases, especially if the risk of fractures is high, doctors may recommend medications typically used for osteoporosis. In summary, osteopenia is a condition of mild to moderate bone loss that signals an increased risk for osteoporosis and fractures. It is diagnosed through bone density testing and should be monitored regularly to prevent progression to osteoporosis. Understanding your bone density through tests like DEXA and working with healthcare providers to manage risk factors is essential for maintaining bone health.